Pause. Shifa. Maternity care, most affordable and compassionate, maternal health care in city of Bijapur.
Hey there, if you're expecting and you've just been told you have gestational diabetes, I know that can be a lot to take in, but you're in exactly the right place. We're going to walk through what it is, why it matters, and most importantly, how you can manage it to have a wonderful, healthy pregnancy. Okay, first things first, let's just take a deep breath. Seriously, hearing any kind of new diagnosis when you're pregnant, well, it can feel pretty overwhelming, right? But I want you to really hear what Dr. Salma Attar says here. This is so common and it is totally manageable. You are definitely not alone in this, and a healthy pregnancy and a healthy baby, that's not just the goal, it's what we're aiming for and what's totally achievable. All right, so let's get right into it. You know, the first step to feeling like you're in the driver's seat is just understanding what's actually happening inside your body. And I want to be clear, this isn't about something being wrong. It's really all about how your body is making these incredible adjustments to grow a whole new person. It's pretty amazing, actually. So the official name is gestational diabetes mellitus, or GDM for short. But all that really means is it's a type of diabetes that only happens when you're pregnant. That's it. Think of it like this. Your body has this hormone called insulin, and its job is kind of like a key. It unlocks your cells to let sugar in for energy. But during pregnancy, you've got all these new hormones coming from the placenta, and sometimes they just get in the way and make that key a little sticky, a little less effective. So how does this whole thing actually happen? Well, it's a pretty straightforward chain of events. First, you've got those amazing hormones from the placenta, the ones doing all the heavy lifting to help your baby grow. The side effect is that they can make your body a little, well, stubborn when it comes to responding to insulin. That's what doctors call insulin resistance. So your body, being smart, tries to pump out more insulin to get the job done. But sometimes it just can't quite keep up with the demand. And the result? A little extra sugar ends up hanging out in your blood. It's like a temporary biological traffic jam, really. Now, you might be wondering, why me? And honestly, anyone can get gestational diabetes. But yeah, there are a few things that can make it a bit more likely. Things like having a family history of diabetes, being over 25, that kind of stuff. But, and this is super important, these are just risk factors. They are not a crystal ball. Plenty of women with none of these factors get it, and tons of women who have several of them sail right through without it. So don't get too hung up on this list. Okay. So we know what it is, but why does it matter? Why is everyone so focused on managing it? Well, it all comes down to keeping both you and your baby safe and sound. And listen, this is not about being perfect. It's just about keeping those blood sugar levels in a nice, steady, healthy range. And this is exactly why it's so important. When your blood sugar is a little too high, some of that extra sugar can make its way to the baby. For your little one, that can mean they get a bit bigger than average, which, can make delivery a little trickier. For you, it can mean a higher chance of things like high blood pressure. But please look at this list not as something to be scared of, but as your why. This is your motivation. These are the exact things we can help prevent with some simple, smart management. All right, enough with the what and why. Let's get to the how. This is the good part. This is your game plan, your personal toolkit for taking charge of this whole thing and feeling fantastic. Okay, first up in our toolkit, food. And look closely, because this is not a diet in the way you might think. It's actually the opposite of starving yourself. The whole idea is to eat regular meals and a couple of snacks. Why? Because that keeps your blood sugar from going on a roller coaster ride. We're talking smart swaps, like brown rice instead of white, and piling on those awesome green veggies. It's all about giving you and your baby a steady, stable stream of energy all day long. And here is probably one of the most powerful and honestly simplest tools you have. It's a game changer. Just a 30-minute walk after you eat. What this does is it makes your muscles soak up all that extra sugar from your blood for energy. It's almost like giving yourself a tiny, natural dose of insulin. It's free, it feels good, and wow, is it effective. Okay, but what if you're doing it all? You're eating right, you're taking your walks, and your blood sugar is still a little stubborn. First of all, this is so common. This is not you failing, not at all. It just means your body and your placenta need a little bit of extra help to get the job done. And that extra support usually comes in the form of medication, like metformin, which is a tablet, or insulin injections. Now, I know medication during pregnancy can sound scary, but it is so important for you to know that these are considered totally safe for you and your baby. They're just another tool in the toolkit, another way to help keep things in that perfect, healthy range. Which brings me to maybe the most important point of all. You are not doing this alone. Not even for a second. Think of it like you have this incredible safety net, a whole team of people who are there to catch you and support you every single step of this journey. And I mean constant, like 24/7. Your doctors, your nurses, they're on call all the time. So if you ever feel a little off or you see a weird number on your monitor, whether it's high or low, there is always someone there to help you figure it out, right then and there. You're never left hanging. So, knowing when to reach out to that safety net is a huge part of feeling in control. This little chart is your cheat sheet. If you start feeling shaky or really sweaty, your blood sugar might be too low. If you're suddenly super thirsty and running to the bathroom all the time, it might be too high. And of course, always keep track of your baby's movements. Knowing what to look for means you can make that call right away without any hesitation. So, are you ready for a sweet journey? Just, without the extra sugar? Because that's what this is all about. Managing gestational diabetes doesn't mean your pregnancy has to be less joyful. It's about you taking the reins, making these smart, powerful choices, and using your whole toolkit, the food, the walks, the medical support, to give your baby the absolute best, healthiest start possible. You can totally do this. You've got this.
Shifa Maternity Care, Dr. Salma Attar. For appointment, call 243761.